Yes, good afternoon, and Friday before a long weekend. And so we'll be talking about some the numbers and how we're doing on that, and Dr. Yaffe will be giving you those shortly. Our key messaging over this time, as you know, the Premier and the Deputy Premier and the Minister of Health announced some potential moving to Stage 1 of Phase 2 next week, looking at, the 19th. We're going to see how we do over this weekend. And as I said, some numbers go up and down, and we're going to talk about that shortly and how that's going to be worked on. And also in that, the key messaging we're going to talk about over the weekend is one of being consistent, and that while there are a lot of other services and areas being allowed to open if they wish, the answer for the public is still to maintain the discipline of distancing, masking in public places where you cannot guarantee you're going to maintain that distancing, and stay around home if you can, but to get out and enjoy some of the weather when you can in a planned way with your family unit, etc. in that regard. And we'll talk about some more steps there. So it's like spring opening up, but not flinging the doors wide open, with caution and care, but enjoying the things that are there now that weren't there and using them in a very good precautious basis. So with that, I'm going to hand things over to Dr. Yaffe for today's numbers.
Thanks very much. Good afternoon. So today we have a total of 21,922 cases, confirmed cases of COVID-19 reported in Ontario. This is an increase of 428 cases over yesterday's report. That said, due to a data upload issue, yesterday we actually missed 87 cases. And while they're captured in today's update of 428 cases, I'm going to present to you the real day-over-day numbers. So yesterday we actually had 345 new cases, which was a 1.6% increase over the day before. And today we have 341 new cases, which is again 1.6% increase. Of our cases, 57% are women, almost 43% are 60 years of age and older, and 62.5% are people who reside in the Greater Toronto Area. 17% of our cases are healthcare workers, 3,722. As always, this is a cumulative number. It doesn't represent those currently positive. Good thing is we continue to see more and more Ontarians recovering and resolving. At this point, 76% or 16,641 of our cases are considered resolved. Currently, there are 986 people in hospital, and of those, 179 are in ICU, and 135 are on a ventilator. So these numbers are going down. Sadly, we do continue to see deaths related to COVID-19. To date, 1,825 deaths have been reported, representing an increase of 27 deaths from the last report. With respect to long-term care homes, our Ministry of Long-Term Care has reported we now have 186 active outbreaks in long-term care homes. 1,320 deaths have been reported among residents and 5 deaths among staff. With respect to retirement homes, according to the information from the Ministry of Seniors and Accessibility, which is provided by the Retirement Homes Regulatory Authority, 68 homes are in outbreak. 180 deaths have been reported. Going on to our laboratory testing, a total of 510,841 tests have been completed in Ontario. In the last day, 18,354 tests were completed, and we have 14,373 under investigation. I want to note that we are almost completed doing the universal testing and surveillance for long-term care home residents and staff. And with those numbers being completed, it's going to open up capacity for testing more people at our assessment centers, and certainly encouraging people who feel they have symptoms and are concerned to arrange through either a self-assessment tool, telehealth, or their primary provider or public health to go to an assessment center for testing. So I'll turn that over to Dr. Williams.
Well, thank you. And yes, so it's a transition over to wider testing, as many have requested in that regard. And so we want to see how that is going to work out. And we do want people with symptoms to be tested in that regard, and how that will work and be facilitated with over 127 assessment centers in the province of Ontario. So this is fairly consistent with some of the other provinces and territories have switched over and are doing some of the same type of testing in that regard. We're going to try and look at our data from the comprehensive survey that Dr. Yaffe alluded to in our long-term care facilities, and we can see that overall in our metrics that our positivity rate continues to come down, and even the numbers when we had the, as I was saying, you have to make sure you're watching the overall slope. Yesterday when we thought we had 258, I was excited like everybody else, and that was good news, but sometimes too good. And the number was actually a rectification, so we didn't go back over 400, which was the good news from today. It was actually in the mid 300s. And still, that number, when we find out the analysis, what is community and what is long-term care, we have been tending around there to be anywhere from 45 to 55% one or the other. So 50% is a good average in the middle there. That still puts us in a good range to move down towards over the weekend into our aspect of case contact management and doing the epidemiological linkage and the drop in community spread in that regard. And that's part of the aspect we're saying as you're going about your business doing those things there. Because if you were to become ill and you did get tested positive, we're going to be asking you, since you did all your aspects there, did you come in contact with someone that you may not have been aware of, or that wasn't in your grouping in that, and therefore then we'd have to know that because we'd have to notify them because they have possibly been contacted and they're positive, and they need to know because they may be inadvertently spreading to other people as well. So that kind of, in a way, logging in your mind and being aware what you did, it would help us greatly in limiting any further spread and getting our numbers right down in that regard. So this coming period, we're ending off the 2-week period, which I said would end on the 17th and starting again on the 18th for 2 weeks. And we're going to map that into potentially on the 19th into stage 1 of phase 2. And then we're going to monitor that for at least 2 to 3 weeks and see how we're doing in that regard. And we hope to have, besides the retail and commercial issues and a number of the other ones that were announced, we hope to have some more information on that, especially around family type issues and stuff that we can deal with, and we hope to have some announcements as the minister had alluded to, and we don't have that all the guidance documents yet, but we may have that as early as by next week or middle of next week. So again, watch that. And this weekend again will be a little bit of good weather, some not so good weather, and so people are going to use their precautions as they go out and around and enjoy maybe some of the amenities that you haven't been able to get out to use in a safe way with the proper public health measures. So this it gives a sense of things coming back into the right phase in the new normal with the COVID-19 framework. And again, we're reiterating the messaging on people going to cottage lands and that again, my message all along has been one of mutual respect, honoring the issues that are of concern to those smaller communities, that if it's not essential, you might want to delay your trip. If you do have to go up, bring all your provisions with you. Keep your social distancing. You don't have to use the local facilities or services in the communities. Sometime in the summer, that'll probably back up, and you will want to do that because you've done that for many years, and they do want to have that kind of relationship with you. But for now, respect that issue, and you can go if you must, but then be careful, be precautious, and respect the community and their issues and concerns in that regard. And of course, always be safe, not just with COVID, but with other things, because with more outdoor activities, people have to use more caution in that way as well. And so watch all those aspects. So that's the messages for today, and we're going to go over to media now for questions.
Okay, we'll move to the phone lines.
First question comes from Janice Golding from CTV News. Please go ahead.
Hi. We've learned, of course, that about 26,000 tests a day are being performed across the country. Less than half of the 60,000 daily tests that should be achievable, according to the Chief Public Health Officer, Teresa Tam. I know that Doug Ford said that he wanted a goal of 20,000 COVID-19 tests per day. We're wondering exactly how many tests are being done at the moment, because we keep hearing people complaining that they haven't been able to get tests. So can you just tell us what the numbers are like with regard to testing in our province, what the goal is, and when you're going to get it up to 20,000?
Dr. Yaffe?
Yeah, sure. Currently, the capacity is just over 20,000 tests a day for the lab network across Ontario. In the last previous day, they tested a total of 18,354. And I have the data somewhere in this pile of the numbers that have been tested, but they have gone up to around 20,000, 21,000. I think the important thing for people to remember is that we are now changing our strategy so that we're encouraging people, if they have symptoms of COVID-19, they should arrange to go get an appointment, go to an assessment center, and get tested. We previously were focused more on doing the surveillance study in the long-term care facilities, and the assessment centers were focused on the priority groups: healthcare workers, essential workers, people who were with serious symptoms, people from Indigenous or remote communities and congregate settings. So now we want to get a better picture of what's happening in the community. So I think the capacity is not a concern at this point. What's concerning is we want to get a better idea of what's going on in the community.
Follow up?
Hi, and you said that originally that your focus was on surveilling the long-term care homes, et cetera. When did you change this strategy to test more people? Because I know 2 or 3 weeks ago I was told by a doctor not to go in. And I know that on the website they were saying if you're not working in a healthcare setting, not to go in. So when did you change this strategy to make sure that everyone can get tested that wants to get tested?
I think the formal communication went out on our website yesterday, I believe, and we mentioned it yesterday at the press conference and again today, and we've ensured there's communication out to the assessment centers as well. It was never that you had to be a healthcare worker, but that was one of the groups that was considered a priority group.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hello, doctors. I was just wondering if there's any update on when we would hear the guidelines for masks. At some point earlier in the week, you had suggested that it would possibly be by the end of this week.
Yes, we have put those together. They are going through the different levels for approval before they go for public communications. So I think it's any time now. We also did see that the federal government had, same as the committee we sit on at the Special Advisory Committee at the federal, provincial, territorial meetings, their guidelines came out. They're pretty similar to ours anyways. And so that's what we wanted to have, that on a pan-Canadian basis, if we're going to recommend the use of non-medical face coverings, cloth if you may, are going to be fairly consistent across the country so as not to confuse public. And I think they are. So ours will be anytime for release once they have all the final approvals in place, but they're all put together. And I don't think there's going to be anything different or surprising than what we've told you already, and are consistent with our general parameters and use and function, again, where they are seen as an adjunct to our distancing. They do not replace the distancing. So the distancing is still there for the 6 feet when you're out in public spaces. But we understand as more and more people get out, especially in the dense urban areas, you may be in situations where you can't maintain that. And then you can use a non-medical face covering. We don't want people going out buying surgical masks and N95s because we need those for our systems in that regard, both hospital and other ancillary services as we try to expand out and get those up and running. So we really have to be good stewards of the overall system and not use or misuse or abuse those type of materials that should be kept for those who really require them for their essential duties and job performance. So stay tuned. We're going to have those out very shortly.
Follow up?
Yes, thank you. Doctor, I'm not hearing the word mandatory anywhere in there. It sounds like it's more voluntary. Do you think that there are any circumstances when masks should be made mandatory, for example, if you take the TTC?
So what we're trying to do is that we like to say definitely recommend or strongly recommend We know there are some people that have some health issues that may find it a bit difficult, may asthma, and they may find it hard of breathing. So you don't want to make it mandatory that they can't do it. We'd like most people be willing and being not only willing but want to do that in those situations there. Some services and stores, as you've seen already, require that they can put those requirements on if they want, and require the patrons to wear masks when they go in, because they may not be persuaded they can guarantee that distancing throughout the time in their facility. And so municipalities can add things in, including their transit systems, if they so wish, and so can retailers and others if they feel they need to have that in order to comply with the public health measures at this time, especially as we go into stage 1 of phase 2. So we're not saying in that sense, but it doesn't mean that local entities cannot increase that requirement in certain circumstances that may be unique to their setting.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Doctor. Sorry, I'm a bit slow on the uptake on the phone here today. Just a couple more questions on the crowd size limit. It's at 5. The health minister indicated we find out next week when it could go to 10. What's holding it up at this point? Is it that you don't want people gathering too much because it's a long weekend, or are there still scientific reasons for this? Some people are saying it's a bit confusing because, house cleaners can go to several houses in a day starting next week, and people can go to more stores. So they're wondering what's the big deal about bumping that crowd size up from 5 back to 10 or even higher.
So, we've had some input from modelers and scientific groups that looks at, as we go to this next phase, knowing that we still have a significant number or a large number of positives occurring every day. We're not down to like 10 or 12 new ones every day. So we still have to put some precautions in there. And as we're trying to keep that transmission rate down, the so-called RE or R naught, there's ways you can do that so that you don't bump that up artificially and start to encourage more widespread transmission. And that means more complexity with case contact management. As you recall, Rob, back when before we put these measures in, when we had 100, 50, those numbers there, we found people who came back from other countries that weren't aware that they were infected when they did become aware. And we asked them, and they said, well, I went to there, and I guess there's 50 or 75 people, not sure who was there. It makes contact tracing really challenging and difficult, and the potential spread is quite wide and far in that regard. So we're looking at how we might do something in a way that would meet some of the, I'd call them the social needs of our public, at the same time trying to keep our R naught down during this time. So while we're moving in stages, it's not throwing the doors wide open, because our goal is, one, the health of the public, and we don't want to do the stepping back. And so we want to move cautiously forward, looking at what the needs of the community are, and that's where some of the services have been opened up. They can go to those in a very careful way. There's other things that people say, well, if you have, use the example of the cleaning staff, they may be their only source of income, and they would like to go back out and make that income. If you're into a place and clean it, I assume when the people come by, and if my office, I'm usually not there, and they clean the office and leave. So I think that can be the same type of stuff. Can you maintain the 6-foot distance? Same as we said before with essential maintenance. If your appliance is broken, we allow that maintenance person in the house, but you shouldn't be hovering over their shoulder trying to learn how to do it. You should be allowing them the 6 feet and staying away, and you deal with the transactions with electronic systems. So you maintain that 6-foot distance in that regard. So can you do that? If you can't do that, then you obviously can't have that that type of service available in your facility or in your location. So again, it's that parameter of the 6-foot distancing and trying to maintain those public health measures as you access some of these other services in and around the community, and as the Premier and others are trying to do to start things back up again so that people can be back to work and making livelihood and income at the same time delivering services in a safe, precautionary basis until we give you some more ideas and direction on that, perhaps later next week.
Okay, we'll take a quick follow-up.
You're now going to change gears a little bit to a different kind of crowd thing. Summer camps. May 24th kicks off summer. A lot of parents, a lot of kids are wondering about the sleepover camps that they go to for a week or two or longer. Where are you on that right now, and when can people expect clear answers? And even now, can you say, do you think it's a good idea to send your kid to sleepover camp this summer?
So we've had lots of correspondence from a number asking for an answer to that one. We have a number of different areas. You have the so-called day camps, and our public health measures group are working through that with the various sectors on what can be done in that regard, because that is a large activity. And then you have, like you alluded to, there was a meeting just the other day with a number of directors and medical leads of those type of camps asking for their input in that. So we hope to have something fairly soon back in that regard, because the season is coming and people want to think of ahead of time in a preparatory phase. So we're working diligently on that, and we hope to have something to report on that to the public in the very near future, in time enough to make decisions around the summer.
Next question.
Next question comes from Phil Perkins from CHCH News. Please go ahead.
Good afternoon, doctors. I've been speaking with a couple of retailers who are scrambling to open up shop Tuesday. They're probably not going to make it, especially the ones who sell clothes that could, they could run into some trouble with people trying them on. And I know we asked this yesterday, but I was wondering if there's any more guidelines that you could possibly share, if you learned something in the last 24 hours, for retailers on how they could possibly disinfect clothes after people have tried them on.
So in that regard, I mean, just because it is possible, let's say we do, as the Premier said, if we all looks good over the weekend and we do go to stage 1 of phase 2 with all those different services that the Premier had spoken about, and the Minister of Finance as well, in there, no one says you're forced to open on that date. You open when you're ready to open. And some may say, we're not really think we're prepared. We don't think we have the right facility to open on that day anyway. So it is a permissive, not a mandatory requirement to do so. And we want you to do so in a way that you can still offer those services in a way that's safe for the public. When you're asking about questions like clothing and trying on clothing, especially if people have done good hand hygiene, there has been no evidence of transmission, especially that you're going to wear it for long periods of time with trying on clothes off and on. I haven't seen any evidence and data that support. Assume that you have washed your hands, you're clean, you maybe have to wear gloves. There's various ways they can do that. They usually steam some of them afterwards. So there's various things they can do and inform each other as they look at the industry, because they do want to offer a safe industry and one that they think is a valuable one. And so I know they only but want to do that, and they'll have the ways that they're dealing with it, and they've talked to our committee, not the Public Measures Committee, but more the Job Recovery and Economic Recovery Committee, that have put those forward in suggestions and that. So I have not seen any evidence in science that says people with passing on clothes, especially when you've maintained limited usage, clean hand hygiene, and proper techniques in there, that they would want to supervise, and having your limited number of people in the store at a time.
Follow up?
And with golf courses and marinas and horseback riding looking to be returned Saturday or the next couple of days, what needs to happen to hopefully have hoops back on basketball nets, allow people to interact in those things that, for the most part, are free?
Yeah, I think it's a matter of, in some of those settings, because the ones you've heard about there, as in horseback riding, you're usually you're supposed to do your own preparation and ride your horse by yourself and all that. And so distancing can be maintained. And those tend to be individual things that you do. Even golf, they're going to make rules that you can't have the big crowd on the first tee. The clubhouse is not open. The 19th hole tee is not there. And you book your time. You don't have big crowds. You're in your foursome. If you're on a cart, use your own cart. If you want to walk, that's fine. Because generally, most people say, and I've had lots of emails, why not open it up? Because I don't crowd. I walk by myself, and stay apart. And they said, we can do that. That's not an issue. And even how you take the golf balls out of the hole and that kind of stuff. So they have all sorts of ways they can do it. If you're asking about basketball hoops and that, if you have one in your garage and you want to shoot hoops yourself, I guess so. It's a question if you put one in a public setting, much like the park equipment and that, how do you not guarantee that you got a whole crowd then playing pickup ball and in close contact? So before you know it, it's out of hand and with best intent. So my challenge back to that is how could you do that? And in maintain it's only one person and they can stay 6 feet apart and they have no contact for the whole time. So that would be a challenge for any sports venue to do that. But I'm sure if they had one indoors and you want to just go and practice and do your shots on your own, I guess someone said you could do that. So it's an individual type activity. So again, common sense combined with precaution and safety.
Okay, we're going to move to the last reporter.
Last question comes from Christina Tenaglia from CP24. Please go ahead.
Can you hear me? Because I can't unmute my call. Can you hear me?
Yes, we can.
Oh, hi. I think you guys can hear me okay. Sorry about that. So, Dr. Williams, we've been getting a lot of questions from people who, of course, have been unable to see their loved one in a long-term care home for weeks and months. These are people whose loved one is not on a main floor at a window. And I'm aware, of course, that essential visitors only is your direction, but I also understand for the Ministry of Long-Term Care that a home determines what an essential visitor is. What I'm wondering is, is it okay for a home to say, you haven't seen your mother and father in 2 months, put on PPEs, come in and say hello? And if not, when do you think you will loosen some of these restrictions, considering, of course, we recognize the largest outbreaks in the province are in Ontario's long-term care homes?
Dr. Yaffe, answer that question.
I really sympathize and empathize. My mother was in hospital during SARS, and I couldn't see her for quite a long time. And I know how difficult it is for the family, how difficult it is for the person. And if you're elderly, it gets very confusing. And you have to balance that with the risk of COVID-19, which can be, as you know, very serious in seniors and people with underlying illnesses. The Incident Management System, or IMS table, is continuing to meet, and we are starting to look at, for those homes that are no longer an outbreak and have all the conditions in place for good infection prevention and control, good supply of protective equipment, the staff are trained up, that they have adequate staff, and so on. How can we start to loosen up and permit those kind of visitations that are so important for people's mental and social well-being? And so we're starting to look at that.
Follow up?
Thank you so much. This is my follow-up question. It's from my colleague at CTV Kitchener, and I understand Dr. Yaffe, you had addressed this in some capacity a few days ago, but a follow-up. So CTV Kitchener has spoken to a Waterloo Region resident who had to be tested 3 times because the first few tests, the first 2 were expired due to lab capacity issues, and by the time the test was ready to be processed, it expired. The local medical officer of health has acknowledged the lab's overwhelmed, which is why they haven't been able to expand testing. Of course, the Premier's directive is to expand this testing. So if you can elaborate on how can the direction be for these labs to expand testing when there's a lab capacity problem?
Yeah, I'm not sure what they mean by it expired. Maybe the specimen wasn't properly kept in the lab or transported correctly, which of course are all very important things. There is a lab network that is over 20 laboratories, the Public Health Ontario lab, hospital labs, and some commercial labs. And the lab people meet every morning and go through what are the issues and how can we resolve them and what are the barriers. So I'm pretty confident that if that issue happened a few days ago, it's been resolved. I'll follow up as well with Waterloo Public Health, but the capacity, is over 20,000 tests a day, and the network's working very well and addressing any barriers that arise very quickly.
We have another reporter on the line that we're going to move to. This is going to be the last reporter.
The next question comes from Jessica Smith from Queen's Park Briefing. Please go ahead.
Thank you. You recently mentioned that plans were in the work to ask public health units to collect race-based and socioeconomic data of COVID cases. Can you say what information they will be collecting, if it includes occupation data, and when the timeline for starting that is?
Yes, we are working on that. Obviously, we're consulting with a lot of different groups around race, and there are, certain issues we have to make sure that everybody's comfortable with the questions that are being asked. We're hoping to start, I would say, in the next week or two. We ask about race, income, and household size because, of course, your income, if you make, let's say, $30,000 a year and that's supporting one person, that's different than supporting a family of 5, for example. There are questions that public health asks around occupation. There are certain categories around healthcare workers. Do they work in, long-term care and so on? And then there are spaces for other. You can put other. So we do try to balance not asking so many questions that the interview becomes hours long versus what is useful information for us to determine who's more at risk of this, sort of person, place, and time. What are the risk factors that make somebody more likely to get infected? And then how can we address those risk factors to prevent other people from getting it?
Follow up?
Thank you. Can you talk about how this data will be made available to the public and the research community?
Honestly, I haven't gotten into that yet, but I think it will be in the IFAS database, the Integrated Public Health Information System database. And certainly we work with ICES, and the information is anonymized. And so at this point, we haven't even started, but that would be one of the considerations.
Okay, thanks everyone, and have a great long weekend.